We're going to perform the neurological assessment. Would you stand right here for me, please? I'm going to begin by washing my hands. Good morning. My name's Miss Behringer. Can I see your armband? Will you tell me your name and date of birth, please?
Nobody and nobody.
Thank you. Today I'm going to be performing a neurological assessment. I'm going to provide for privacy. Okay. And I'm going to ask, do you have any allergies?
No.
And do you have any pain today?
No.
Okay. I'm going to begin with health history questions. So, do you have any history of headaches?
No.
Stroke?
No.
Neck pain?
No.
Any problems swallowing, chewing?
No.
Do you have any history of stroke?
No.
Disability?
No.
Do you have any problems with movement?
No.
Going to the bathroom, transferring from the bed to your walker or wheelchair? Do you use any assistive devices?
No.
So I'm just kind of going through any sort of neurological or musculoskeletal issues. Do you have any history of accidents?
No.
Trauma? Head injuries?
No.
Any surgeries on your bones or muscles?
No.
Okay. So no surgical history. Okay, I'm going to begin with the balance test. So I'm going to do a Romberg test. I'm going to have you stand up nice and straight and close your eyes. And when the test is over, I'm going to touch your shoulders. I'm going to hold my arms out to the side in case you feel off balance. Okay, you can close your eyes. We'll stand here for 20 seconds. Okay, test is over. And now I'm going to have you do some gait tests. So could you walk 6 steps this way normally for me, please? Thank you. Now go backwards, a tandem walk, heel to toe. 6 steps that way. Okay. Now will you do heel to shin? And if you feel like you need to hold on to something or sit, I want you to do heel to shin, up and down your shins. Okay. All right, balance and coordination is intact for those movements. We're going to play some finger games to test your coordination. So will you take your finger and touch it to your nose and to my finger? Okay, now we're going to do finger to finger. So will you do this and go faster? Okay, and now will you pat your thighs, alternating your hands? Okay, now go faster. Okay, coordination is intact. You can have a seat. Could you close your eyes for me, please? And hand me your hand. I'm going to place an object in your hand for stereognosis. Okay, can you tell me what this object is?
Cotton ball.
Okay. Keep your eyes closed. I'm going to draw a number on your hand. Can you tell me what number I draw for graphesthesia?
3.
Okay, good job. All right, you can open your eyes. I'm going to test your muscle strength now. Could you grab both my fingers here and squeeze? Thank you. And push my hands and pull. Hold your hands like this. Pull backwards. Okay. And take your wrist. Push up. Okay. Push down. Okay. Push up on your knees. Pull down. Push out. Pull in. Push up with your toes. And give me the bottom. Okay. Push down. Okay. So muscle strength is a 5+ in all extremities. All right, let's do sharp dull. You're going to do test point location. You're going to break your Q-tip in half here. One side is sharp. I'm going to show you what it feels like. And the other side is dull. I want you to close your eyes and tell me if you feel sharp or dull and where you feel it.
Sharp, my left arm. Dull, my right hand. Dull, right leg. left leg. Sharp, left leg.
Okay. That's test point location. Now I'm going to do cranial nerves. We're going to start with cranial nerve number 1, olfactory. So I have a scent on this. Could you tell me what scent this is? Does it still smell?
It still smells.
Okay.
Is it minty or lemon?
Peppermint.
Peppermint, okay.
All right. Cranial nerve 2 is the optic nerve. So we would have the patient do the visual acuity chart for optic nerve to test that. And we don't need to do that again because we just did it. We're going to do cranial nerves 3, 4, and 6 now. That would be oculomotor, trochlear, and abducens. So I'm going to do perla to test those eye muscles. Would you follow my pen? I'm sorry. I'm going to check your pupils. Look straight ahead for me. Okay, and follow my pen light in. Okay, so pupils are equal, round, responsive to light and accommodation. And we're going to do cardinal gazes. Can you follow my pen with just your eyes? Okay, no lid lag or nystagmus noted. So cranial nerve 3, 4, and 6, oculomotor, trochlear, abducens are intact. Now we're going to do cranial nerve 5, trigeminal. So we're going to do touch on the light touch on the face. Can you close your eyes and tell me where you feel this cotton ball?
My forehead. Cheek. Cheek. Chin.
Okay. I'm also going to feel your muscles here around your TMJ joints. Can you open and clench your jaw? Okay. So cranial nerve 5, trigeminal nerve is intact. Now we're going to do cranial nerve 5, trigeminal nerve is intact. That's correct. Cranial nerve 7, the facial nerve, we're going to do taste. So face for taste. Can you identify this substance that I have prepared?
I'm just tasting it.
Mm-hmm.
I have trust issues. Dump it.
Just you can pretend. Okay. So we're going to identify that the taste is intact for the facial nerve. And then we're going to do facial movements. So can you smile, frown, puff out your cheeks, raise your eyebrows, close your eyes, and don't let me open them. All right. So cranial nerve 7, the facial nerve is intact. Cranial nerve 8 is vestibulocochlear nerve or acoustic nerve. So we would do the hearing test. So do the whisper test. What am I whispering?
3, 4, 6.
Okay, do both sides.
1, 5, 7.
Okay. All right, so then we're going to do the Weber and the Rhine test. So tell me if you hear the sound equally on both sides for the Weber test.
Yes.
Okay. And now we're going to do the Rhine test, placing this on the mastoid process. Let me know when you no longer hear.
No longer here. No longer here.
Okay. So air conduction should be greater than bone conduction, but hers was bone conduction was greater than air conduction. Okay, so that was the Rhine test. So cranial nerve 8, acoustic nerve is intact. Cranial nerves 9 and 10, 9 and 10, glossopharyngeal and vagus nerve. So say ah for me.
Ah.
Okay, and can you swallow? So I'm checking that the patient has the uvula is midline and she has a gag reflex and can swallow. So that was cranial nerves 9 and 10, hypoglossal and vagus nerve. I think of vagus as in don't throw up in Vegas. Yeah. cranial nerve 10X. Okay. Number 11 is spinal accessory. Can you shrug your shoulders against resistance for me? And we're going to make an 11 for spinal accessory, and I'm going to do each side of the face. Can you turn your face towards my hand? Gets resistance. Okay. So resistance with turning the head. So that's spinal accessory 11. And then we have cranial nerve 12, hypoglossal. Can you stick out your tongue? Okay, tongue's midline. And now can you say light, tight, and dynamite?
Light, tight, dynamite.
Okay, so speech is clear and tongue was midline. So cranial nerve 12 is intact. Now we're going to do deep tendon reflexes. So we're going to start with biceps. You're going to hold your arm. Just relax your arm. Let it go dead. Okay. And I'm going to do the bicep. There you go. The biceps reflex. I'm going to strike the bicep nerve. Okay. A little twitch. I'm going to do triceps. Let your arm go dead. Okay. Triceps right below that elbow. Okay. A little jerk out. And then brachioradialis. Let me do this arm. Okay, so relax your arm. Okay, I'm going to strike right here. And a little twitch in the hand. So brachioradialis, patellar. I'm going to raise the bed up a little so our feet are dangling. Okay, so patellar is just below the knee. That's moving. Okay, all right, that's patellar. Should make the knee extend. We're going to do Achilles. Just relax your leg. You might have to take off your shoes. You have to take off your shoes for this one. Have your client take off their shoes. Okay. So Achilles, strike the back of the heel. And then we're going to do plantar, which is using this part. You're going to draw an upside down J. And you shouldn't see any movement there. Put your shoes back on. Okay. All of the reflexes were 2+, which are normal. And now we're going to do the musculoskeletal part of the checkoff. So we're going to, I did all my health history questions up in the beginning. So now I'm just going to do inspection first. And the joints are symmetrical. You may want to palpate joints. There's no edema or swelling. They're bilateral. No redness. You want to inspect that. Now you're going to inspect the spine. So would you stand up, please? And when you turn around, stand behind your patient. Can you bend over and touch your toes? Okay, you're going to observe that the spinal curvature is straight. Okay, you can stand up. All right, and then we're going to have the patient, can you sit down for me and lay in the bed? It's easier to do range of motion in the bed. So flex your arms and extend. Okay, and then I'm going to do the knee ones here. I'm going to do hip, so you're going to do internal, and this is external, and internal rotation, and extend the knee. Okay, can you take your ankles and roll them? Okay, so, okay, and can you sit back up? Can you raise your arms above your head? Chest shoulder mobility. Okay, and then can you do your neck around? So just try to do some range of motion exercises with all of your joints. I did the palpation when I did my inspection, so you can do that together if you like. And then ask about ADLs and functional assessment. I kind of did a lot of those questions in the beginning, but you could still ask it here because it is about movement of your muscles and joints. Do you have any problems transferring from the bed to the chair or to the toilet or to the bathtub? Do you use assistive devices? Do you need any help getting dressed, grooming, bathing? Those kind of questions. The last thing is to do carpal tunnel tests. These are fun. Can I see your wrist, please? I'm going to do the tunnel test. I'm going to tap on the median nerve. Do you have any burning or tingling with that? Okay. You would do both sides. Any burning or tingling? Okay, Tinel test is negative. Now we're going to do the Fallon test. Can you put your wrists together like this and make them 90 degrees? Okay, we're going to hold this for 1 minute. After the minute, do you have any burning or tingling in your wrist?
Yeah.
Okay, negative Fallon test. And then I'm finished with my exam. Is there anything I can do for you before I leave? I have time.
Thank you.
Okay. I'm going to put my bed back down to the lowest position. Okay. I'm going to make sure all of my things are within reach. I'm going to check for pumps, lines, equipment, and safety before I go. And wash my hands, exit the room.
Thank you.
You're welcome. Thank you.